بس الاسم Okay, now okay. So did we talk about guanethidine? Not yet. So we are talking about different mechanism of action of how do drugs lower the blood pressure. ليه متأخرين يا صبايا؟
كنا تحت.
طلعت الدرج لساتني عم باخذ نفسي تخيل قلت لها يا حسين.
كلنا دكتور عندك مصعد
بس كانوا الشباب معبين بمصعد ما استنى. So we talked about the different mechanisms and we said we have to know the general mechanism of these. We're not going to ask you about specificities except for special things. So the next group اللي هم drugs that we call sympatholytics. What do I mean? So it's a big group that composes many mechanisms of action. These drugs are going to either inhibit the release of norepinephrine. Excuse me for a moment. ألو أنا بحاضرة بدي أروح ولا استنى؟ Okay, bye. Sorry about that. المفروض يطلع ابني قبل ويحكي معي بس تأخر. So I sent him a message to tell him call me when you finish. Okay. So adrenergic neuronal blocking agents work through multiple mechanisms. One of them can be to deplete norepinephrine from presynaptic, postganglionic sympathetic nerve terminal, and either presynaptic, or to prevent the action on the postsynaptic sympathetic nerve terminal. Also, we have drugs that inhibit the release of norepinephrine in response to sympathetic nerve stimulation. So what are these drugs? The net effect of these drugs is going to be inhibition or decrease in the release of norepinephrine, so it's not going to be able to act on its peripheral organs. With relation to the cardiovascular system, it will result in reduction in cardiac output and total peripheral resistance. It's going to have a lot of other effects on different systems of the body that are innervated by the sympathetic nervous system. That's why we don't like to use these drugs a lot because they have multiple side effects. But there are certain indications for their use. So the first drug, guanethidine, it works as a false neurotransmitter. So it enters the peripheral nerve terminal through the same transporter as norepinephrine, and then it gets stored in these vesicles. And once we have a stimuli in the presynaptic nerve terminal to release norepinephrine, guanethidine will be released instead of it. That's why we call this drug as a false neurotransmitter. So it can deplete norepinephrine stores in the vesicle. يعني هو حيجي يدخل داخل الفesicle ويطرد norepinephrine from the vesicle. That's why we will have less release of norepinephrine. The pharmacokinetics, it has a very long half-life of approximately 5 days. When do we use this drug? It's indicated only for moderate to severe hypertension that is refractory to other treatments.
لورين ولا هاي دكتور؟ لورين لو هاي
Okay, one thing that it does, هاي الأدوية they do because they activate they prevent the activation of the sympathetic nervous system. Let me fix that. They prevent the action of the neurotransmitter on the sympathetic nervous system receptor. The body tries to compensate for that. So it's the body compensation is by increasing the production of renin. So if you look at patients who take this drug, you might find higher levels of renin. But it's not specific for either low renin or renin hypertension. The main indication for it is here, blood pressure control for patients who are unmanageable by other antihypertensive medication. But we don't use them إلا إذا عندك مريض جربت مع كل أنواع الأدوية وما اشتغلت معه, so we revert to this last resort. How does it work? Another drug, riserpine. وسألوني زملائكم هل نحفظ هذا الاسم اللي بين قوسين؟ لا هذا اسم تجاري, just an example of these drugs. It blocks the transport of dopamine into the storage granules in the nerve terminal. احنا بنعرف أهمية الدوبامين. It's a precursor for the synthesis of norepinephrine. This results in depletion of the stores of catecholamine, but also it causes depletion of the stores of serotonin. يعني هو also it enters the vesicle and kicks out serotonin from the vesicle. So one side effect, as your colleague has said, it can cause depression. Both of them does that. The net result on the high blood pressure will be decreased sympathetic tone, total peripheral resistance, and cardiac output. This drug also have a very long half-life. Its plasma half-life is 11 to 16 days. It's largely metabolized through microsomal enzymes in the liver. What are the side effects? You would think about the effects we would get from preventing the activation of all sympathetic receptors in the body. With regards to the cardiovascular system, it's going to cause hypertension, but we wouldn't worry about reflex tachycardia in this case. Why is that?
لا لانه
Through vasodilation, and hypertension is through vasodilation. Yes, because we are inhibiting the sympathetic on the heart as well. We are preventing norepinephrine release. So norepinephrine effect on the vasculature will be less, but also norepinephrine on the heart. So one side effect is actually bradycardia. As we said, it causes depression. They can cause nasal congestion. Both drugs can cause impotence, but more so with guanethidine, diarrhea, and salt and water retention. Maybe there is ليه بيعملوا salt and water retention.
الرنين يرتفع.
Excellent.
نحاول يسوي.
We said one compensatory mechanism that the body have is to try to increase لما تعمل انت hypertension, the body try to fix that by causing increased renin secretion. This causes more salt and water retention. So this is actually a drawback for these drugs, and we have to sometimes use another drug that causes excretion of sodium, which is, what drug do we add to fix this problem? Diuretic. So a lot of time we can add diuretic to help us with this retention of sodium.
شو يعني impotence؟
Impotence اللي هي erectile dysfunction. اللي هي inability for men to sustain an erection. You'll learn more about it with treatments. The treatment of it of sildenafil or Viagra, but there are other treatments. And why is it related to the cardiovascular system? Because it's one form of endothelial dysfunction, the inability of endothelial cells of the blood vessel to release nitric oxide. Nitric oxide is a vasodilator, and this is the mechanism of erection, the vasodilation of the penile blood vessels.
هو modulated by sympathetic or parasympathetic both.
both وفي even في non-sympathetic, non-parasympathetic and non-autonomic control also. So the drug interactions for these drugs, the drugs that alter the function of the amine pump, they will utilize the same transporters as dopamine or norepinephrine to get ففي similarity between those transporters. They can transport a lot of drugs. So what other drugs can be transported by these transporters? Tricyclic antidepressants, monoamine oxidase inhibitors, ephedrine, amphetamine, phenothiazine. So it's also going to interact, prevent their absorption. أعطانا دوايين مش absorption, sorry, their transport. أعطانا دوايين that will compete for the same transporter. Less of them will be transported, so it can cause a decrease in the response to those drugs. In addition to that, after chronic use of guanethidine, the above agents اللي حكيناهم could cause hypertension due to development of receptor supersensitivity. As I said, they are rarely indicated. These وبدي نظبط هاي الجملة فيها غلط. They are not the alpha adrenergic blocking agents. The sympathoplegic agent or sympatholytic agents are not frequently prescribed because of their multiple adverse effects, and they can be the last resort in refractory. Refractory يعني it is not managed by other medication and manageable hypertension. هاي جملة ممكن تهم بعض companies. Risperidone is cost effective and it's very cheap. But as I said, we do not use it anymore because we have drugs that are more efficient, that have less side effects. Central alpha-2 adrenergic receptor agonist أو centrally acting sympathoplegic drugs, central alpha-2 agonist. كل هاي أسماء لنفس group of drugs. So what you learned about these drugs last year, these are agonists of the alpha-2 receptor. Who can remember names of them? Clonidine, excellent. So again, let's remind ourselves, we talked about it last time, I think, but also, what is the function of the alpha-2 receptor? Where is it present and what does it do? Excellent. So the main thing we're going to focus on in this mechanism of action of these drugs, it is present presynaptically, nerve terminal. The function of it, it's a feedback mechanism. So if you remember, what were the ways to get rid of excessive أو نحكي to stabilize how much norepinephrine I need in the synaptic cleft? There are multiple mechanisms. Remember, there is uptake mechanism 1, there are uptake mechanism 2, there are enzymes such as MAO and COMT, and there is the alpha-2 receptor. The alpha-2 receptor gets activated by norepinephrine. It tells the synaptic end, stop releasing further epinephrine. So if I activate this alpha-2 receptor by my drug, clonidine, and also we have alpha-methyl-dopa, this will also decrease the release of norepinephrine from the synaptic end terminal. What did I want to say? But yet, selectivity is not absolute, so they can have sometimes some effects on alpha-2 receptor الموجودين بالvasculature. There is a small subset of these alpha-2 receptor and also an alpha-1 receptor. So they can sometimes at high concentration increase the blood pressure by the direct activation on the alpha-1 and alpha-2 receptors peripherally بالvasculature. But نرجع للmechanism of action. We have methyl dopa and clonidine. They cross the blood-brain barrier. They stimulate the alpha-2 receptor in the vasomotor center in the brainstem. This results in inhibition of sympathetic and increase in the parasympathetic outflow to the periphery, resulting in decreased blood pressure. And that's why in the this slide, they are called sympathoplegic agents, even though they are an agonist. يعني they're going to decrease the sympathetic tone or activation. Yes.
أغلب الأدوية تعمل كروس للبرير. هل نحتاجها تسوي هيك ولا؟
هلا for these drugs, yes, because it's going to be centrally acting على alpha-2 receptors both the central nervous system and peripheral nervous system. فبمنع activation of the sympathetic nervous system centrally. بعض الأدوية بهذا الدواء, yes, we do need it. Other drugs يعني مثلا antihistamines, first generation antihistamine, they do cross the blood-brain barrier. بتعرف شو الانتيهستامين أدوية الحساسية. That's why they cause sedation as a side effect. لأنهم because they have effect there. هلا رحنا لأن هاي it's a drawback for us because people need to take them during the day. They need to drive and they cannot do that while they're sedated. So that's why the second generation antihistamine were developed where they do not cross the blood-brain barrier. So it depends on our target. بس برضه إحنا رحنا استفدنا من هذا side effect. Some people can use antihistamine to help them sleep.
دايفينايل صح؟
Yes.
دايفينايل هاي.
So with second generation, يعني they don't all, we say they are second generation because they don't cross the blood-brain barrier. Some of them actually cause sedation as a side effect. So it's not an absolute differentiation. بالنسبة لهاي الأدوية we need them to cross the blood-brain barrier. مثلا propranolol, حكينا the effects of it, what we're talking about, they are peripheral, but it crosses the blood-brain barrier and it causes side effects associated with that. It causes nightmare, it can cause depression. So the mechanism of the reaction we talked about, they result in heart rate decrease, cardiac output decrease, total peripheral resistance, plasma renin activity, and baroreceptor function are all reduced. Vascular Okay, the effect on the vascular smooth muscle cell, the alpha-2 adrenergic receptor is present there, and this can cause vasoconstriction even though it's not evident clinically unless they are given at high doses or intravenously. Another thing about alpha-methyl-dopa, it's a prodrug, and you remember prodrugs are not active, they need to be metabolized in the body in order for them to perform their function. They're gonna be converted actually through the synthesis. هم قلت لكم they take the place of dopamine. واحنا بنعرف dopamine is a precursor for norepinephrine synthesis. So instead of dopamine, the body will utilize alpha-methyl-dopa, and this will result in production of alpha-methyl-norepinephrine, which is a false neurotransmitter. So it does not have the same capabilities of activating the alpha-adrenergic receptors as norepinephrine. Another thing about these drugs, for clonidine, it is available as a transdermal administration, as a patch that is replaced once a week. So it can be useful for some patients who cannot tolerate or take an oral medication regularly. Side effects, they cause dry mouth, drowsiness, dizziness, and we said they cause sodium retention. But when used at low doses, we don't need to add a diuretic for the side effects. But sometimes because depending on the patient, sometimes we have to add a diuretic to get rid of the sodium retention.
دكتورة؟
Yes.
احنا قلنا السلايفري جلاند يتحكم بيها الباراسمباثيك بس.
Yes.
ليش يصير الدراي ماوث سايد افكت؟
لأنه لما نعمل إحنا inhibition للسمباثيك بيزيد الباراسمباثيك outflow.
بس المفروض يكون ويت ولا دراي ماوث يعني ما في باراسمباثيك؟
صح. هلا الباراسمباثيك is regulating two kinds of the saliva. واحد الcopious so maybe it's through another mechanism. Yes, you are right. انتوا بتعرفوا انه الباراسمباثيك والسمباثيك تيرم بيتحكموا بالسلايفا actually. واحد and this is
بالالدوستيرون يتحكم بالسمباثيك ممكن؟
لا هلا انواع السلايفا مختلفة. So one of them is more watery saliva, هذا الباراسمباثيك, and more of the saliva. This is
سيرس وميوكس.
okay. الكتيرة الباراسمباثيك لأنها بتساعد بالهضم. And this is how I memorize them. I don't memorize stuff, I link them to something. And then the sympathetic will be more viscous and less so, but both of them control salivation, but it's different types of saliva. Okay, clonidine, a drug interaction, tricyclic antidepressant can reverse the antihypertensive effect of clonidine. يعني, as we're going to learn later on, the CNS tricyclic antidepressant, they cause an elevation of the blood pressure, one of the drawbacks or side effects. فإذا بتعطي الدوايين مع بعض, one of them will lower the blood pressure, the other will increase it. So we wouldn't really benefit from this combination.
دكتورة؟
Yes.
شو اسمه بروزاك يسوي هايبوتنشن صح؟
البروزاك مش
هو
monoamine
opposite
oxidase inhibitor ولا tricyclic antidepressant.
بس هم يعني same class of the antidepressant.
It's an antidepressant, but it works through a different mechanism.
بس يسوي هايبوتنشن صح؟
I'm not really sure, but what's the side effect associated with it? But it's a selective serotonin reuptake inhibitor. When you learn about it more, it's going to interact with other stuff. بس ليش هم tricyclic antidepressant بطل استعمالهم واستعضنا عنهم بالSSRIs؟ لأنه because they have multiple side effects, especially their interaction with the autonomic nervous system. Alpha-methyl-dopa can cause, clonidine causes sedation as well. I don't know if we have put it there, but also alpha-methyl-dopa causes sedation, dry mouth, sodium retention, and dizziness. With prolonged use, anemia or hemolytic anemia is a rare side effect. هذا للألفا-methyl-dopa. Having said that, again, our drug interaction. Methyl-dopa is the first choice for hypertension during pregnancy. It's an old drug. It's a very safe drug, one of the safest drugs during pregnancy. But nowadays, we can use other drugs of the newer families, such as beta blockers, can be used in pregnancy, especially if I have a hypertensive patient who's using this drug, she can continue to stay on it. Having said that, في studies that they show it crosses the placenta, so it's going to get to the fetus. So it can cause some deregulation or dysregulation with cardiovascular أو autonomic nervous system نحكي regulation بالفيتس. في ناس they wouldn't like to use it, but clinically people have used it and we haven't seen serious side effects with their use.
هو الدوبا دكتور صح؟
لا هلا أنا بحكي الدوبا هو the first choice let's say.
أنا طلعت البارح الجايد لاين يقول لك اللابيتالول الفيرست لاين.
Yes, so beta blockers are used. هلا nowadays هذا كان زمان هذا دواء قديم هو it's one of the safest. زي ما قلت لكم اللابيتالول أو البيتا blockers they are used in pregnancy, but some studies have shown that they cross the placenta and they can cause hemodynamic changes in the fetus because of their effect on the beta receptor, but they are used.
يعني
yes.
first line صح؟
هلا ممكن new guidelines say that, but this is the يعني بنحكي لك بامتحانات USMLE بيقولوا لك the safest drug in pregnancy for anti-hypertension it is مثل دوبا. I don't know if تغيروا الأسئلة.
بس يعني مثل
بس هلا because beta blockers are used nowadays more often and these drugs have more side effects, but it's considered a safe drug to be honest. So أنا بعرف أنا قرأت يعني I looked it up also. So it's according finally to the doctor to decide what's suitable for that patient. هلا also nifedipine is used in pregnancy. One of the يعني شو هم الأدوية الhypertension that are used in pregnancy. You're gonna find beta blockers. You're gonna also find nifedipine as well. اللي calcium channel blockers.
يعني دكتور الميثيل دوبا والال دوبا same or different؟
لا الدوبا is different than methyl dopa.
Both used for hypertension during pregnancy صح؟ أو لا؟
لا الميثيل دوبا. أنا حكيت الدوبا if I said it it's wrong. الدوبا اللي هو الليفودوبا اللي هو دواء يستعمل بالباركنسون. So we're talking about methyl dopa. هم شبيهين ببعض. اثنين لهم علاقة بالدوبامين. الدوبا حنتكلم عنه بالCNS. It's activating also dopamine receptors. So another use for clonidine, it's useful in the diagnosis of pheochromocytoma. So احنا بنعطي المريض clonidine. So it's gonna suppress release, central release of norepinephrine. So if we have a certain limit, I think it's put here, it will reduce norepinephrine to lower than 500 picogram per ml if the patient does not have the tumor. إذا أعطينا الكلونيدين وضل الليفل أعلى من هذا الليفل, that means it's not a central release of norepinephrine, rather sure there is a tumor that's releasing this neurotransmitter. هاي السلايدات شوي أضفتها أنا جديد اللي هم ganglionic blocker, and I got them from the autonomic nervous system lecture, the one I have. So you learned about them, but they can be used to treat hypertension. We have trimethoprim, pentolinium, and mecamelamine. هي أكيد تحكي بطريقة أحسن. So how do they work? This is what we are interested in. They are working at the ganglia. They are called ganglionic blockers. So what kind of receptors we have there? بالجانجليا بالautonomic nervous system ganglia. شو عندنا نوع receptor؟ لا نراجع الautonomic. هلا في عندنا احنا sympathetic و parasympathetic, right? In both the sympathetic and the parasympathetic at the ganglia, it's the same receptor. What kind of receptor? Nicotinic receptor. So they are blocking the nicotinic receptor at the ganglia. So they're going to block the transmission of both the sympathetic and the parasympathetic nervous system. So what do you think their effect will be on the vasculature?
Vasodilation.
Vasodilation, excellent. Why is that? لأنه بس because we only have sympathetic nervous system innervation for the blood vessels, and the parasympathetic nervous system does not supply or innervate the blood vessel. So how would I be able to decide what will be the effect on the different organs? Most of the organs are dually innervated by the sympathetic and the parasympathetic.
في واحد دايما التون أعلى.
Excellent. So we have a predominant tone. And this table will help us remember this predominant system. So for example, this is the cardiovascular system. The dominant tone is in the heart is parasympathetic. وهو بالheart حتى هي it's depending on the side of the heart. فبال SA node it is parasympathetic. So what would be a side effect of the use of these ganglionic blocking agents on the heart? Bradycardia ولا tachycardia؟
تكي والكونتراكتيلتي تقل.
صح, excellent. فالcontractile myocardium is under mainly sympathetic nervous system control, but the SA node is under parasympathetic nervous system control. So let's try to remember. Parasympathetic راح يعمل bradycardia. I am opposing the ganglia, preventing the activation. I'm going to get tachycardia. That's why the net result of these drugs will be tachycardia. حكينا بالarteries والvein, it's only under sympathetic control. That's why we have vasodilation in both of them, or dilation of the veins. And here I don't have the myocardium, I got it from another book. حكينا the tissues that are predominantly under parasympathetic are myocardium and SA node والatrium, resulting in tachycardia if we blocked it. So this is the effect of a ganglionic blocker. While the myocardium, the ventricle are mainly under the control of the sympathetic. So if I want to reverse sympathetic movement, increase contractility, I'm going to have decrease in the contraction or in the contractile force. We have all these other side effects of the drugs. That's why we do not like to use these agents. For example, when is trimethophan used, it's an extremely short-acting agent. The major therapeutic use is the causing or the production of controlled hypertension in certain surgical procedures and under emergency treatment of a hypertensive crisis. فبالتالي إحدى استعمالاته, if I have hypertensive crisis, يعني I have a patient coming to the emergency room with a very high blood pressure, in this case I give him an IV infusion of trimethophan, or we have other drugs we're going to talk about a little bit later that are used in the hypertensive crisis, but they have to be very fast acting. One important side effect for these drugs, again, they're going to have multiple side effects by blocking the ganglia, blocking the parasympathetic tone. But other side effect, it causes potentiation of the effect of tubocurarine in surgery. Why is that? What is tubocurarine? Let's start with that. Yes.
Relaxation of voluntary muscles.
Excellent. Tubocurarine is a drug that's used for relaxation of voluntary or skeletal muscles. So I taught you that, I remember, so you should know it. It's a skeletal muscle relaxant. When do we use it?
Surgery.
Surgery. So it is used in surgery. حكينا, when I'm preparing, it's one of the drugs used to prepare the patient for the surgery. It's not used because يعني it is used during surgery. It's going to be maintained because I want to maintain muscle relaxation and muscle paralysis. The first thing, during pre-surgery, I want to intubate the patient. Very hard to intubate داخل أنابيب حلق المريض if the muscle are pushing against it. So that's why we need it. During the surgical procedure, during the dissection or removing of the organs, it's easier to move around through a relaxed muscle than it is through a tense muscle because you might damage the muscle. How do these drugs work? Tubocurarine. مين متذكر؟ حسين. مين متذكر القصة اللي حكيتها عن
الانتاجونست وشنو نستخدمه قبل نستخدمه بالصيد؟
Excellent. It's a nicotinic antagonist. So متذكرين قصة النيتيف Americans اللي كانوا يستعملوا؟ It's a history. They used it during hunting. So they found this poison. They would dip حكينا tip of the arrow, يعني يغمسوا السهم تاعهم بهذا البويزن بعدين they shoot it.
هو الدكتور يسوي شو اسمه سبازم في الدايفرام صح؟ دايفراماتيك سبازم.
هلا بيعمل هو باراليسيس لكل المسلز. راح يجي هذا الهانتر الصياد ويطير السهم من الانبوب تاعه عشان هيك سموه الدواء تيوبوكيوراري. هلا الستراكشر تاعه is curarine and because they use that tube to طيره to blow it. Yes. It was caused tubocurarine. بعدين هذا البويزن it will get in the animal. وين راح يجي بالمسلز and it will cause paralysis. ما راح يموت الانيمال. No. He will get paralysis or relaxation بالمسل بيوقع بالارض بيجوا بيذبحوه بياكلوه. I asked you at that time, why didn't the people who ate the animal get poisoned by this drug? It does not get absorbed through the GI tract. عشان هيك احنا بالعمليات in the surgery we are using it IV. Why? Because it's a highly polar compound, so it does not get absorbed through the GI tract. فلأنه هذا الدواء it's tuberculari بيستعمل بالعمليات. حكينا trimethoprim can be used to have controlled lowering of the blood pressure during surgery. We can have this antagonism or drug interaction. Both of them are going to work on the nicotinic receptor, so it can aid or increase the effect of tuberculari, which might be problematic. Next group of drugs we're going to talk about are called vasodilators. Now, remember that I said calcium channel blockers can be vasodilated, and some people when they teach pharmacology بيحطوا calcium channel blockers مش كلهم. Which ones do I put under vasodilators? Nifedipine, excellent. And this is what I want you to know. Nifedipine وإخوانه. We call them dihydropyridines, yes, but what I'm more interested in يعني تعرفوا شو هم الأدوية. The other drugs اللي هم verapamil and diltiazem, حكينا they mainly work on the heart. They affect the vascular smooth muscle, but they also work on the heart. So I wouldn't call them a vasodilator. What other drug can we call vasodilator from what we learned so far? No.
كلوريدين.
هلا حنحكي عنهم هذول احنا ما حكينا عنهم محاضرة hypertension. Nitric oxide, excellent.
كلوريدين يسوي vasodilator.
Yes, but a direct vasodilator. They work specifically on blood vessels. وله علاقة بالأوتونوميك. The alpha blockers, excellent. So alpha blockers sometimes can be considered as vasodilators. So how do these drugs work? They're gonna relax vascular smooth muscles, causing arteriolar vasodilation, leading to decreased peripheral vascular resistance and decrease the blood pressure. The exact mechanism of how they work, for some of them it is known, or some of them it's not very known. هلا احنا بنعرف انه عندنا calcium channel that have to have an inward current of calcium to have muscle contraction, and then we have potassium channel. Some of these drugs, such as hydralazine and minoxidil, they causes activation of potassium channel, leading to hyperpolarization of cells, which causes blockage or inhibition of calcium channel, thus leading to vascular smooth muscle relaxation. First drug I'm talking about is called hydralazine. Hydralazine is a very old drug. The exact mechanism of action is not known. It's known to cause hyperpolarization of the cell. Maybe it is through potassium channel, but it is one of the drugs that was used a long time ago. It's still used. It's used a lot in research, actually, because we know it is a potent vasodilator. So sometimes, a lot of times, when we do research on animals, we use hydralazine as a positive control. Okay. For example, when I did my PhD work, I worked on angiotensin II. We were giving a new drug for these animals, and we wanted to look at the effect of this new drug on lowering of the blood pressure. So for us to have another control, we use hydralazine to see the effect of hydralazine also on lowering of the blood pressure in these animals as a positive control. It's a comparison for us for our new drug. When do we use it clinically? Can an effect decreases total peripheral resistance. This can result in sympathetic activation of reflex responses, and it happens for all vasodilators. So this results in increased heart rate, heart contractility, and increased plasma-renin activity. قبل ما أحكي على indications, خليني أحكي one important note about the pharmacokinetics. Even the plasma half-life is very short for this drug. The antihypertensive effect stays for 12 hours because it gets accumulated or attached to the blood vessel wall. Side effects of these agents are reflux tachycardia, and we said this is very dangerous because it can precipitate a myocardial infarction in an elderly patient or patient who have coronary artery disease. And we said the reflux response can be blocked by the use of propranolol. We said it can also cause sodium and water retention. It's the body mechanism to counteract this hypotension or vasodilation, and it's of course caused by excessive renal release, and this can be counteracted by the addition of diuretic. Other side effects that are similar to all vasodilators: it causes headache, nausea, and dizziness. It can also cause symptoms similar to lupus syndrome.
دور البروكاينامايد يسوي لوبس البروكاينامايد؟
Symptoms similar to lupus, not the syndrome.
لا.
Yes.
البروكاينامايد
Yes.
عشان يسوي نفس الشيء لوبس سندروم؟
Yes, بس مو السندروم. السندروم lupus erythematosus is an autoimmune disease. So it causes symptoms similar to the lupus syndrome. يعني نسميها lupus syndrome لأنها symptoms شبيهة.
هذاك يسبب الاوتوميون نفسه.
البروكانامايد؟ لا.
كمان سندروم.
Yeah. Okay, another drug called minoxidil. When did we learn about minoxidil? بالهيد صح بالmale pattern baldness. حكينا it's one agent that was originally designed or originally used as an antihypertensive agent, but later on لاحظنا إنه patient who used it they have increased hair growth. It accentuated hair growth. That's why they started to use this drug to treat baldness or thinning of the hair.
شيء كمان شغله بس يوقف التريتمنت بصير في ريباوند هير فول
Rebound hair loss? Okay. So how does it work? It activates ATP sensitive sodium. مقرأ أنا بالعكس sorry. potassium. شوي غلطت بالمحاضرة بدل صوديوم حكيت potassium. تكون من السرعة الواحد لخبط. Channels, and this causes hyperpolarization, which leads to inhibition of calcium channel, leading to smooth muscle cell relaxation, resulting in arteriolar vasodilation and decrease in the total peripheral resistance. Just want to make sure I didn't skip a slide. This drug needs to be metabolized in the liver to form the active metabolite, so it's a prodrug which is called minoxidil NO sulfate. What are the side effects? It's going to be similar to the vasodilator, similar to hydralazine. Another special side effect, حكينا بيزيد نمو الشعر. It causes hypertrichosis, accentuated hair growth. So when do we use it? It is only used to treat severe hypertension and must be given with a diuretic and a sympatholytic agent, usually a beta blocker, to decrease inhaled reflex tachycardia, with diuretic to decrease sodium and water retention. فبالتالي in hypertension, it's only used to treat severe hypertension that's not responding to other treatments. So the indication severe resistant يعني ما عم تتعالج بالأدوية الثانية hypertension. Another drug, another vasodilator called phenoldiazepam. هاي جديد لسه مو موجود عندكم. It's a dopamine agonist. Activation of the dopamine receptor. Where are the dopamine receptors in the vasculature? موجودين أكثر شيء بالكدني. So it causes vasodilation, especially the renal vessels dilation. It also enhances sodium excretion, natriuresis. It's a short-acting drug. When do I use it? I use it in an emergency situation by continuous IV infusion or in certain operations. So the patient have to be hospitalized. If I have a sudden or severe elevation of the blood pressure after the surgery, we can use these agents. So هذا من الagents اللي يستعملوا in a hypertensive crisis. High picture is showing us what are the compensatory responses to vasodilators. But why did we talk about addition of drugs? What happens? So when I use a vasodilator, it's going to cause decreased systemic vascular resistance, leading to decreased arterial pressure. This will cause decreased renal sodium excretion. Another thing it causes increased renal release and increased sympathetic nervous system outflow. هدول two effects, they are responsible for some of the side effects. So increased sympathetic nervous system outflow will cause increased heart rate, cardiac contractility, and also this will lead to reflex tachycardia. It causes decreased venous capacitance, which will increase cardiac output, yes, leading to increased arteriolar pressure. This is the compensation of the body. Increase renin بيزيد الangiotensin. Angiotensin causes increased vascular resistance, increased aldosterone. Aldosterone will cause decreased renal sodium excretion. So that's why sometimes we have to give other drugs to combat these effects that happen in compensation of our body. يعني نلخص, this is how the reflex tachycardia occurs, and we give a drug for it, beta blocker. This is how sodium and water retention occurs, and we can add a diuretic to get rid of that problem. So another group of drugs, or another topic we want to cover, talking about vasodilators that are used in the hypertensive crisis. So we can use hydralazine and minoxidil. Another two drugs we can use are labetalol and carvedilol. What are these drugs?
Carvedilol is antagonist of كل
beta. So they are beta blockers, yes, but they have another characteristic. They are also alpha blockers. So it's not for all receptors. So they are beta and alpha 1 adrenergic receptor blocker. فبالتالي بنستفيد من هاي الأدوية كتير بالhypertension because we want to cause dilation by blocking the alpha 1 receptor, but we don't worry about the reflex tachycardia because they are beta blockers, so they will also decrease the contraction of the heart and increase in the heart rate. Another additive of these agents, additive value, remember when we talked about beta blocker that they cause lipid abnormalities? These drugs are free of this side effect, so they don't cause changes to serum lipids. Other drugs that we want to talk about, nitric oxide. So some drugs that cause vasodilation are releasers of nitric oxide. We're going to talk about new drug here. It's not a new drug, it's a very old drug, but a new drug ما حكينا بحضر ischemic heart disease. It's called sodium nitroprusside. Sodium nitroprusside شبيه بالنيتروجليسرين بالmechanism of action تاعته, it liberates nitric oxide, which causes dilation of vascular smooth muscle cells, thereby it decreases total peripheral resistance. This drug is given by an IV infusion. It's very fast acting. With regards to administering this drug is light sensitive. غالبا بيكون بأمبولة that is protected from the light, so it's a dark glass ampoule. It's fast onset of action, but also short duration of action. So the antihypertensive effect ceases upon stopping of the infusion. احنا بنعرف إنه nitric oxide is a very short-lived gas. يعني على طول هو بصير له diffusion بيروح على vascular smooth muscle cells, it's going to bind to its receptor or target, اللي هو guanylate cyclase, and work. If it stays longer in the body, it's going to bind to a lot of proteins and cause modification for these proteins. So we will lose the active drug. So the duration of its action is very short. It can be metabolized to sodium thiocyanate, which is slowly cleared from the kidney. We don't want this to accumulate too much in our body because toxic accumulation of cyanide can lead to lactic acidosis. Why this drug is not used a lot, because as we said, it has cyanide or cyanide in it. An overdose of it will be lethal. Side effect, it works very fast. It stops the effect after we stop it, so we can have rebound hypertension and tolerance developed to this drug. Diazoxide, diazoxide. Also, it is a dilator of arterial smooth muscles through activation of potassium channel. It doesn't have a lot of effect of the venous smooth muscle, so it's very similar to minoxidil, but the difference, it's mainly used intravenously. Minoxidil في an oral form of it, and we said minoxidil can be given to patients who are resistant to other treatment, and this is home treatment. It can be given as an oral medication. Diazoside is only administered IV. It has a very fast onset of action within 2 minutes. The duration of action lasts a little bit longer, or a lot longer than SMP. So we have preservation of the hypertensive effect. Side effects, it can cause tachycardia, which can predispose to an angina or ischemic attack. We talked about labetalol and carvedilol. We said they have a mixed effect of alpha-1 and beta-adrenergic receptor antagonism. So they will block the adrenergic receptor in the blood vessel and the heart. This is with regard to their selectivity. Labetalol is 1 to 3 and is more selective for the beta-adrenergic receptor. Carvedilol is 1 to 10 selectivity between the alpha and the beta. So they have higher selectivity for the beta-adrenergic receptor, but still they have an effect on the alpha-1. The net effect is decrease in the total peripheral resistance without worrying about reflex tachycardia.
دكتورة بس سؤال على you mentioned إنه no changes to serum lipid بس البيتا بلوكر مو changes they have يعني they are يعني not used for
البيتا blocker مش contraindicated
يعني
but we have to worry about it. We have to watch out for it. بس هدول الدراجز يعني الستراكشر تاعهم yes I know إنه هو السيرم lipids is according to their mechanism of action. But these do not have a lot of effects on serum lipid. Exactly, the mechanism is not known. So they are good to be used in cases when we have contraindication to use beta blocker because they will change serum lipids.
يعني هو شو اسمه؟
carvedilol ولا labetalol
أي
مالهم؟
يعني labetalol does not change serum lipid like the other group?
Yes, exactly. So I think we stopped for today. Okay, so this is a repetition of the slide before. So the last thing we'll start with next time. احنا خلصنا هيك على فكرة الأدوية. بدنا نحكي how do we treat antihypertensive? How do we use antihypertensive medication? How do we treat a hypertensive patient? What do we start with? How do we switch from one drug to one drug according to the condition of the patient? And then we'll start with another topic اللي هو either lipid lowering or heart failure. شوف حسب عدد الستايدات وقد ايه بضل.
وخلاص دكتور بس هذول توبكس
heart failure next week.
يعني 3.
لا هذا خلصناه. We have lipid lowering tomorrow. مع كمان سلايد ضلوا. We will talk about heart failure next week. So 2 lectures about heart failure.